Somebody was asking. So Vivek, you were not here. So before starting today's session, I just dropped a question that the last year was the year of AI, and because nowadays, to be simplified, anybody can ask the question, and it gives you a beautiful summary of what he or she wants to ask. Then what's the need of such lectures, or what's the need of audio clips or something like that? So I want you to raise your hand and let us know honestly about this answer. What is that thing which is missing there, or which we need here? Yes, Vignesh.
Hello, good evening, sir. Can you hear me?
Yes, Vignesh.
Yes, sir. So for me, it's about knowing what other people have understood. Like it's sometimes I only won't get doubts. Sometimes others will be getting some doubts also. So it helps me how to get another perspective or point of view other than my own point of view. And second point is the language. Sometimes even though the language English I can pretty much understand, but sometimes medical jargon is not only just about the proper English language.
Mm,
Sometimes the live lectures helps giving us certain examples like what we gave with balloons, balls, and etc. So
okay.
that won't AI won't be able to give that example. And systematic way of learning. Sir, in AI, if I ask a question, it will answer only just about that question. But in a video lecture or something like that, we'll go from start to end in a systematic way. And if there is someone for me to guide in what way to go, it will be better than for me to search and plan a way in which way to go. I think in
Very
that point of view, textbooks and video lectures helps me a lot than AI. AI will be helpful, like just clear a point of doubt, like single question or two questions.
mm,
For a whole, getting a whole picture, I think textbooks or video lectures will be better for me.
very nice. Very nice thoughts.
Thank you, sir.
Whole point. Thank you. Whole picture. Bhavya. Yes, Dr. Bhavya.
Yes, am I audible?
Yeah, yeah, audible.
Sir, I think there is a saying medicine is like music. It
Mm,
cannot be learned, it has to be imbibed. So AI can only give you facts, but it is a teacher who gives you an intuitive understanding of the subject and a mental roadmap as to how to really tackle practical situations.
okay.
So I don't think that AI can ever replace live teaching or live interactions.
Okay. Surinder. Thank you. Thank you, Dr. Bhavya. Surinder. Atharvan.
Yes, sir. Good evening.
Good evening.
One thing about AI is that a lot of times AI just creates when we have questions which are really niche or questions which are really out of the way, it creates a response just to give an answer, sometimes even though it is wrong. And this has been shown time and again. And AI creates fake responses or fake answers, even though it does not have an answer. Plus, most of the data that the AI runs on is taken from a general consensus. If I ask a question regarding a case or regarding a query related to mechanical ventilation, it might give me a generalized answer,
Mm,
but only a professor who has been only a doctor who has been working for a long time on mechanical ventilators can say that, okay, I have experienced a case like this, or I have seen a case like that. And that insight is really valuable when it comes to learning.
very nice. Which model do you use?
So far, ChatGPT and Gemini AI.
Okay. Okay. Thank you. Thank you. Andy?
Good evening, Dr. Gupta. Yeah, I think basically, everybody has said what I had in mind, so I just want to resonate what they say. I
Can
think
you
one
make
of
a video?
yes, I do. I don't know that the lighting is going to be great, but
No, it's very good.
so yeah, just to resonate what everybody's been basically saying, I think one of the great advantages of the course is how organized we go from session to session. Yes, you can always ask, AI questions, but first of all, you don't know what questions you don't know. You can't ask questions about things that you don't know. So the way we go in a very organized fashion helps to consolidate the information greatly. So that's a huge advantage. Second, what they already mentioned, AI doesn't always get it right. And there's always an issue with I always tend to trust an intensivist with a background such as yours a lot more than what AI has to say. And whenever there's discrepancies between what is talked about in class and what AI says, it motivates you to go look and fact check and everything. But yeah, those I think are the two biggest advantages. Is the experience that that intensivists with such backgrounds have. AI is never going to have, and it's hard to believe a computer. For me, it is anyway. I believe a human a lot more than a computer still.
Thank you, Andy. So very valid point. What question you need to ask? You don't know actually what questions needs to be asked to AI. That's wonderful. Dr.
Exactly.
Sagar. Yeah, Sagar.
Good evening, sir.
Good evening.
Sir, as my learned colleagues have already mentioned, sir, I think out of all other aspects, ventilation is the most dynamic of things. So it's evolving every day, each day. So for an AI algorithm, it needs some static information to comment upon. So that can never be replaced by an individual who is deeply engaged in critical care and observing all the dynamic changes, dynamic updates that have been brought in, who's practicing this every day. And that input, sir, I don't think unless established by some literature, any AI model could be able to give. Sir, and in addition, it needs a lot of judgment, sir, the ventilation and mechanical ventilation, all these concepts. So for an AI model, it needs a lot of information. Many times we don't have enough information to make decisions upon. At that time, the experience and a kind of clinical judgment is absolutely required, sir.
Okay. Nice, Dr. Sagar. So we'll take one more from Dr. Sunil Kedia.
Good evening, sir.
Good evening.
I am not able to on the video because of some technical reason.
Okay.
Although a lot of people have said about AI, one thing I want to say that, okay, AI will not replace us, but it can assist us, because I think in future there will be devices which will be AI assisted, like nowadays in every device, in mobile, in laptop. And AI will give you the data, it will say the algorithm, but it will be depend upon whatever data they have accepting for analyze that situation. But in day-to-day activity, in not only in ventilator, sir, in whatever technique, whatever procedure, you see 100 procedure for IV cannulation. But if someone is not teaching you in your hand, by holding your hand, that how to introduce this line or catheter, whatever, small procedure even. Sometimes we'll read that this drug will work on this way, but if seniors has not told you or you have not used in your medical practice, it's very difficult to accept a new technique or drug or whatever is. So AI definitely it will help us in future also, now helping in most of the things, but cannot replace the human touch, feeling, critical judgment, because it's a life-saving instrument, sir. It is not like that a mobile you can change in next day. It is a life of a patient. One mistake will lead to your death of the patient. So I think here seniors advice, doctors advice is not in ventilator only, I will say in any treatment part of ICU, sir.
Thank you. So we'll take one last, because already 10 minutes late. Krishna.
Hi, Dr. Ankur. After hearing so many people, so many big people talk about this, it's like a young person talking about it. It's probably not going to be relevant. But I'm a researcher in Mayo Clinic, and I do work with AI models. We're training an AI model to identify aortic stenosis in echo images. And the thing that I notice is a lot of the times its function depends on what you feed it. If you feed it good quality images, it generates good answers. If you feed it bad quality images, it generates bad answers and underperforms significantly compared to regular trained sonographers who are able to get the image acquisition that they want. So a lot of the times I feel like the data that goes into training the model is by far the most important aspect of what AI we use. So if we use something like open evidence, which is widely available and used here in the US, it is much more valuable than to use a general large language model like GPT or something else, which tend to hallucinate. And lastly, I think I would say that there's a quote by the founder of Anthropic, the company that owns Claude. He said, "I'm surprised that people think AI hallucinates. I am actually more surprised that people think that it does anything other than hallucinate."
Okay. Thank you, Krishna.